Today on our new findings in cannabis research segment, we welcome Madison Maynard, a doctoral student at the University of Central Florida, where she conducts research in the Older Lab and Real-Time Lab. Madison is here to talk about her recently published study, Daily Impact of Medical Cannabis on Anxiety and Sleep Quality in Older Adults, published in the journal Psychiatry.
Great to have you on the podcast today, Madison, and congratulations on your publication.
Thank you.
I chose to feature your study because I'm interested in the potential of cannabis to treat pain and improve sleep for older adults. I think your study was right in the wheelhouse of that. So maybe we'll just ask you, what were the main findings of your study?
Our study was conducted with 100 older adults. And in this age group, it was adults who are 55 and up. We recruited them nationwide. And we looked at how medical cannabis use in the moment affects their subsequent pain, sleep, depression, and anxiety. And so this study was done using methodology called ecological momentary assessment. And there's a lot of jargon there, but the summary is what we can do is we have participants answer surveys on their phones every few hours throughout the day, right? And so we ask them every few hours, have you used any medical cannabis? And then we ask them about their symptoms. How is that affecting your pain, sleep, anxiety? Not even directly, how's medical cannabis affecting them, but just we ask them for their pain, sleep, and anxiety and depression ratings. And what we found is that in the moment, on the days when people are using more medical cannabis, they're getting immediate relief of pain, depression, and anxiety after they've used. But medical cannabis didn't seem to be directly improving their sleep. Instead, we found something interesting, which was that to the extent that the medical cannabis was improving anxiety, people then had improved sleep. So anxiety was sort of this mechanism that was helping to improve sleep rather than medical cannabis directly.
Interesting. Okay, so an indirect effect. What are the implications of your study and where does that lead you for future research?
I talked about how we looked at this momentary use of cannabis and we saw these immediate momentary reductions in pain and mood symptoms. So that's all fine and good. But another big unanswered question that this methodology leaves hanging is, what does cannabis do for our pain symptoms and our mood symptoms in the longer term? So our study kind of answers this question or starts to disentangle this question of how does cannabis affect our symptoms in the moment? And then it leaves unanswered these future questions of, does that momentary improvement align with the longer term effects that we're seeing? So for example, in the mental health world, we think about development of anxiety disorders, depressive disorders, which are more of these global conditions that are present for a longer period of time. So our study answers the question that people are getting this immediate relief, but leaves unanswered the questions of what might happen in the longer term. Are you going to get lasting relief for your mental health symptoms or your pain symptoms? Is there any potential that you can become dependent on cannabis? We've also learned through this study that medical cannabis may not be as effective for sleep as we thought it was, or maybe it is effective for sleep just to the extent that it is affecting anxiety. So the big question that I think we're trying to answer here with this line of research is, for whom is cannabis effective and under what circumstances?
If you could design a perfect study to answer all of your questions, or at least answer your central question, and you had unlimited resources, what kind of study would you run?
There are so many different routes of administration of medical cannabis. People can smoke, people can vape, people can use edibles, all kinds of different things. And so there's a lot of variability in who's using what. That's one of the biggest challenges when it comes to this kind of research, is actually being able to model what types of cannabis usage, what routes of administration are effective for what problems. You can do a randomized control trial where everybody's taking the exact same product at the exact same time and the same amount. And then you can test the effects of that product. Or you can do what we do, which is let people use what they would actually use in the real world in real time and evaluate the effects that they get that way. So I don't know that either method is more or less perfect or that there's one right way to study it. As far as psychological symptoms and real world implications, I like the real time measurement a little bit better, letting people use what they would normally use and tracking how that's affecting them in their daily lives. There are really no perfect studies in psychology because all of the constructs we're measuring, anxiety, depression, can vary. And the best that we have are questionnaires. But I think one of the biggest starting points would be to use a large enough sample. So if you're talking unlimited resources, we'd want to include a lot of participants. We'd want to get really good representation of people that are using from different backgrounds, different cultures, different age groups, kind of be able to see if there are differences in those groups or just make sure that we're representing everybody who's actually using.
The sample that you were able to get was
Mhm.
largely white, non-Hispanic women, and they were older adults. So how did you define older? Was that over 50 or over 65? Where'd you make the cut?
So in this first study, we made the cut at 55. This study was the first one that we've done of this kind. And in the future, I think we're going to start looking more at the 65 plus range because you run into the issue where, a 55-year-old surely doesn't look the same as a 75 or an 85-year-old. And so to group them all together into one sample,
Yeah.
bit of a limitation. In our study,
Okay.
though, we didn't see age differences. So
I think it's a brilliant career move and scientific move to study cannabis and aging. It's such a booming area, pardon the pun. How did you end up choosing cannabis and aging as a topic? Was it chosen? Did it choose you or did you choose it?
that's a good question. I like that question. So I am currently a PhD student and I am mentored by two advisors. So Dr. Daniel Paulson and Dr. Robert Dvorak. And I guess my first introduction to this was when I was an undergrad and I worked with both of them in both undergrad and grad school. I was taking her class and one of the professors played this video of an older adult who had Parkinson's disease. The video showed his symptoms of tremor and then talked about how medical cannabis was going to improve that tremor and showed kind of a before and after of this older adult with Parkinson's disease having a lot of tremor symptoms pre medical cannabis and then the tremors being completely reduced after taking THC. And I thought maybe this is something that could really be useful for older populations. I've always had an interest in neuropsychology. That's kind of been my career goal. And then come to find out, I start doing a little more research and medical cannabis actually doesn't have a lot of evidence for being effective for Parkinson's disease at all. So I was kind of confronted with this idea that maybe it could be useful for some people, but also it seemed like there's a lot of misinformation out there. I'm even getting misinformation in my college level course I'm taking. So I spoke with my advisors and one of them studies aging populations and the other one studies substance use. And we came up with this plan together of, hey, there's this emerging phenomenon happening where older adults are using medical cannabis at much higher rates than we've ever seen before. Let's start looking into this. And that's sort of how I got into it. And that's where we are now.
Great. Is that going to be the subject of your dissertation?
Sure
Older
is.
adults and cannabis? Oh, fantastic. Well, we're looking forward to that. And do you have any papers or research that are on the horizon? Or are you just rebooting and getting ready for the next one?
Yes. So my advisors and I have so far published a couple of papers from this first data collection. And I did want to acknowledge that this first study we did was funded by the Consortium for Medical Marijuana Clinical Outcomes Research. So we really
Okay.
appreciate that support. We have one or two more papers coming out of that study looking at how do different medical cannabis use motives affect people's resultant symptoms. So, for example, if you are using to treat your anxiety versus if you're using to treat your pain or nausea or something like that, what are the long-term implications of that? And it seems that there are some differences. And then another line of study we've got on the horizon involves how different neurocognitive profiles might impact one's medical cannabis use or their
Oh.
resultant mental health after using medical cannabis. And then we've got one more area of research looking at how we can promote safe use among individuals using medical cannabis. So using something called protective behavioral strategies, which is, for example, like not using too much in certain situations, making sure that you're safe while you're using, a long list of strategies. But how can we promote safe use among these populations?
Oh, that's fantastic. That's going to be something we'll want to talk about in the future, I'm sure. And I'm looking forward to that.
Mhm.
Well, I want to thank you for coming on the podcast and discussing your
Right.
research. And I'm looking forward to hearing more.
Yeah. Thanks so much for having me.